Hey guys, welcome back or to my channel. My name is Sophie, and if you are new here, hi, welcome. I am a certified medical assistant. I film videos on medical assisting, lifestyle. I vlog every now and then for vacations. And I really film anything and everything. I always love recommendations. I love thrift shopping and everything like that. So if you guys have any recommendations or ideas for me, just leave them in the comments down below. And with that being said, I am filming a medical assisting related video today, and it has to do with the virus. And I say it like that because apparently if you say the actual name of the virus, YouTube doesn't like that and they like to monetize you, and you're not as likely to be seen. So I'm just going to say the virus. Everyone knows what I'm talking about. If I get demonetized as in this video doesn't have ads, it's okay. I'll just try to avoid it as much as I can, but at the end of the day, YouTube is gonna do what YouTube wants to do. So for those of you who do not know, I have been a medical assistant for about 9 months now. It'll be a year in June, and I work in an OBGYN clinic Monday through Friday, 5 days a week, and a lot has changed in the past few weeks since the virus has gone into play and has been migrating into the Wisconsin area, and we actually have a positive case in the county that I live in. So about 2 weeks ago, it started to become more serious in Wisconsin, I would say. In the bigger cities near us, south from us, there were like more positive cases, and it just kind of kept coming up towards where I live in central Wisconsin. And so we knew we kind of had to start taking things more seriously. So we started a new screening process when you first walk into the hospital or the clinic. I work in the clinic, and it is connected to the hospital through like small hallways that only staff can go through. But the public can't go from the clinic to the hospital unless they like are escorted, if that makes sense. So if you're coming to the clinic, in our clinic we have the walk-in, a lab, a family practice, rheumatology, pediatrics, and OB. So that's everything in our clinic. And so we started a screening process at the door. We call it the walk-in door, and it would be an MA or a nurse, one or two of us, and we would be sitting there. We would stop every patient before they walked in. And for the first week, we had to ask them if they had any cough, fever, shortness of breath, if they had traveled more outside of outside of where we live more than 2 hours, and if they have any known exposure to a positive virus. If they answered yes to those, we would give them a little hotline number, and they'd have to go out to their car and call this hotline. And they'd call, and then the hotline would ask them all those same questions, but way more in depth, and then they go from there. They could either come back into the clinic if they were cleared, or they'd have to go get swabbed for the virus, or they'd have to self-quarantine for 14 days. So nurses from our clinic were actually working the hotline number. I think there was 8 at a time. They sat in this office with phone calls, and they were just receiving phone calls nonstop of patients or anybody in the general area calling and saying, okay, this is my symptoms, this is where I traveled, what do I do? If they met the requirements to get swabbed, we had a swab drive up at the ambulance bay for the first week, and you'd have to be given a time, and you'd come get swabbed, and then you'd have to obviously self-quarantine for 14 days unless it came back negative and your symptoms went away. Then I believe it was shorter, but don't quote me on that. So they were only swabbing about 5 to 10 people a day for the first week. Obviously everyone wanted to be swabbed, but they were basically just telling people like, just go home and see if, which I don't know if I agree with. This isn't me like picking a side or like sharing my beliefs on what's right and what's wrong with all of this. This is just me saying what my clinic and hospital did, just because I think some people might be curious. I'd be curious to know what other clinics and hospitals were doing. So if you work in the healthcare field and you have a YouTube channel, you should definitely film a video and then tell me if you filmed it so I can go watch it. I apologize if this video is all over the place, but that's generally how my videos go. I don't usually have a very clear mind when it comes to talking. So that was like the first week, and then the second week we started taking temperatures at the clinic when you walked in, for staff and patients. Also, I forgot to mention that if you were an OB patient, you could have one support person. If you were an elder that needed help, like you were hard of hearing or like cognitively delayed, anything like that, you could have one person with you that was healthy. But if you were, and obviously kids could have a parent, but if you were going into the walk-in and you were an able-bodied adult, like you had to go alone, you couldn't have a support person. So we sent a lot of people out to their cars, which created a lot of angry patients. I was yelled at multiple times. People tried to steal masks and gloves from my hand. And I had to politely say that there is literally a national shortage of medical supplies and we are canceling surgeries because we do not have the supplies, and people were just not understanding and very rude. So working down at the entrance, I only had to do it 3 times, but it was exhausting, and I did it from 6:45 a.m. till 3 p.m. and it was a long day, but we all kind of had to take our turn and do our part, so it is what it is, really. So that was just like before you even got into the clinic. Then the second week we started canceling all non-essential appointments up in the OB clinic. I believe all specialties did that, but we did for sure because obviously you're more high risk, at risk if you are pregnant. So we canceled all non-essential, so that would be annual exams, surgery consults, obviously because we weren't scheduling surgeries for like a long time because surgeries were getting canceled and pushed back. Basically we were only seeing OB patients. We were pushing back IUDs, we were pushing back everything like that, just, I mean, non-essential. We did call some people that were like a 6-week postpartum, and if they've had multiple kids and they are fine, we said, okay, you call us with any questions, we can fill your prescriptions, but if you don't need anything from us and you feel good, you don't have to come back until your annual exam time. And most people were like, yeah, like I'm good, like, or they were like, yeah, I'll wait the 4 to 6 weeks and then come back. So most people were understanding about that, which was awesome. They canceled all non-essential surgeries, so hysterectomies, anything like that. Basically they were just doing C-sections, because that can't be delayed 4 to 6 weeks. Clinic was basically a ghost town. And then this past week was spring break week that a bunch of doctors already took off for spring break. They obviously didn't go on spring break, but they still canceled or kept their schedule canceled. So this past week it was pretty slow, and this next week I think it will start picking up again a little bit more. It's really hard to tell. It's really just a day by day. We are being told a million different things a million different times, and I'm just trying to do my job and stay out of it. Yeah. I asked you guys on my Instagram any like specific things you wanted me to talk about in this video. So if you're not following me on Instagram, definitely go do so. It's at sophia.d.drees. I'll put it up here and I'll also put it down in my description box if you forget, so you definitely go check that out. And I just got a few, so I'll go over them quick. Someone asked me, working in the medical field, do you know things before the public does? And I don't believe so. It's not like we're hiding anything. Everything's pretty much public knowledge at this point. Everything's on the news. And I'm also going to link the CDC website down below if you guys have any specific like questions. Like, I obviously am not a doctor. I don't know like, no, that's not me trying to like explain the virus to you or anything. No, no, no. And someone also asked about visitors and potential risks for mothers and babies. And so for the visitors, I think I mentioned earlier that in the clinic you get one support person if you're pregnant or you need a support person like to help translate or anything like that. And then for the hospital side, for like labor and delivery, you get one support person and they have to be healthy. If you're pregnant and your husband has a cold, he cannot come in, which is so sad and makes me really sad for all those women going through that. So definitely, I'm sure that's how it is at all hospitals at this point, but definitely where I work, those are the rules right now. They are changing so frequently, and honestly, working in healthcare during this kind of time, like, it doesn't even feel real. It's just like fast paced and job security. That's all I gotta say about that. Anyways, I hope you guys enjoyed this video and I gave you a little bit of insight on what my clinic and hospital is doing with this whole pandemic and virus and everything like that. If I didn't cover everything, definitely leave me a comment down below and I'll try to answer it as best as I can. Otherwise, DM me on Instagram if you have any specific questions as well. Hope you guys enjoyed this video. If you did, give it a thumbs up. Don't forget to subscribe, and I'll see you guys in my next video. Bye!